Hello guys, welcome to my video. So in this video today we're going to be looking at a question in IRH, specifically targeting a gyne emergency known as postpartum hemorrhage. This is part 1 of this question, and with me here is an NMCZ question which reads, so you can pause the video to read the question. But to save time, I'm actually targeting question B, which says describe the management of Mrs. Siwale in the first 48 hours. That's following a diagnosis of postpartum hemorrhage. Okay? Yeah. So let's begin. Management of PPH is considered as an emergency. So how should the headings flow? How the heading should flow is exactly how and what I'm going to talk about in the video. So stay tuned and pay close attention. So firstly, what will our aims be? The first aim is that to resuscitate the patient. Pardon me for the typing error. The second aim is to identify the cause of bleeding and stop it. You can also add a third aim to be safe, and that can be to call for help. Then after your aims are done, the next heading is call for help in the management. Here, you can explain as I have written. I will call for help by shouting PPH in labor ward to mobilize other staff such as the physicians, anesthetist, the midwives, the porter for quick and effective management of the condition. Secondly, you immobilize a PPH tray containing sterile cannulas, needles, syringes, emergency drugs, gloves to be used on the patient, and so on. And then you can also make this statement: I will immediately collect blood samples to take to the lab for grouping and cross-matching in case of a transfusion. Having done that, we can move to the next set of headings, and is that of primary assessment and resuscitation. So here we're going to follow the ABCDDD, which is airway, breathing, circulation, degree of consciousness, deformities, and drugs. As you have observed, we commonly stick to 1D, which may either stand for the 3, but in this case we're going to do all the 3 so that you maximize the marks that you get when answering this question. So airway, you assess and move on if you don't find anything wrong. So I will assess the patient's airway for any obstruction or occlusion by secretions or foreign objects, of which in this case there is none. You move to the next heading. I will assess the breath rate or breathing of the patient by observing for presence of use of accessory muscles when breathing, as this will indicate difficulties in breathing, but of which in this case there isn't. Thirdly, circulation. This is where we do much of the work and much of the writing. Number 1, I will assess the radial pulse of the patient to assess and ascertain cardiovascular function, as this is going to review a pulse which is weak and thready. This is going to be indicative of hypovolemic shock. Secondly, I will cannulate the patient on both hands, the left and right, using a sterile cannula. It can be a green or gray cannula. So you cannulate for administration of fluids and emergency drugs, as well as blood transfusion. Then the second heading is that I will commence Ringer's lactate and normal saline on the right hand, Ringer's lactate on the left hand, and in the pack where you're giving normal saline, add 20 international units of oxytocin so that this can stimulate uterine contractions, as uterine contractions are going to help stop the bleeding. When that has been done, the next is blood transfusion. So after the results have been prepared and are ready, remember we took blood when you called for help, so by this time we would have gotten results. So you can explain to say, I will commence blood transfusion promptly following the announcements or proclamation of results, as this is going to correct hemolytic anemia as well as hypovolemia. With that said, The next heading is that of degree of consciousness. Here, what do you say? I will use appropriate assessment tools or neurological assessment tools in order to ascertain the level of consciousness. I will use a Glasgow Coma scale, which will help me ascertain if the patient needs to be referred to ICU or not. If the Glasgow Coma scale is less than 7, I will refer the patient to ICU for specialized intensive care. If not, you move to the next heading, deformities. So here you say, I will assess for any deformities of the reproductive system or the genital tract, such as the vulva, the perineum, and the vagina, as well as the cervix. Okay, and then drugs. You can now explain to say, I will give tranexamic acid because that's an emergency drug. This is supposed to help stop the bleeding by promoting blood clotting. You can also give adrenaline. Adrenaline is supposed to increase cardiac efforts by increasing cardiac output. Then you can also give symptometrin. So symptometrin is a combination of two drugs. There is syntocinon and egometrin. I shall drop the doses in the comment section. These drugs are supposed to control blood pressure. Egometrin is responsible for controlling blood pressure in the sense that there is hypovolemia, meaning even blood pressure is low. So symptometrin is an active vasoconstrictor, which is going to reduce the containing capacity of blood vessels to match the low volume of blood, but still to sustain an adequate oxygen carrying capacity. With that being said, ladies and gentlemen, we're done resuscitating our patient. However, even after resuscitating, this patient is going to still keep bleeding. Why? Because we haven't stopped the bleeding. So the next heading is that of stopping the bleeding. So we're going to stop the bleeding according to 5 causes. Remember, this is still management, so you write this in your management. Stopping the bleeding can be according to the 5 causes. Number 1, atonic uterus. So if the cause of bleeding is due to atonic uterus, you are going to wrap up contractions. So you say, I will wrap up contractions by massaging the fundus of the uterus, as this is going to help stop the bleeding because the muscle, which is the fundus, is going to contract, hence closing those blood vessels at the site of placental attachment. With that said, you go to the next one. If the cause of bleeding is due to retained membranes, pardon me with the typing error, I will conduct an emergency MVA, which is manual vacuole aspiration, so as to remove the retained products of conception, as these interfere with the process of uterine contraction. Then you go to the third one, which is if the cause of bleeding is due to retained placental tissue, then I will conduct manual scraping, meaning you make a fist or fold your hand and go into the uterus through the vagina. There, you are going to gently scrape off the placental tissue at the site of attachment, and this is going to help restore normal uterine action. As the uterus contracts, even the site that was bleeding is going to stop. Then the fourth one is that of trauma. So if the cause of bleeding is due to trauma, that being either uterine rupture, cervical tear, vaginal tear, or perineal tear, there you can explain to say, if trauma is due to any of these, for example, we pick perineal tear, I will promptly suture the perineal tear so as to stop the bleeding. If the cause of bleeding is due to ruptured uterus, I will quickly prepare the patient for emergency surgery. So meaning you're going to prepare the patient so that the patient's uterus can be fixed from theater. You don't do that from the labor ward. Then the last one, if the cause of bleeding is due to bleeding tendencies, for example, prothrombin deficiency, you're going to give vitamin K. You're also going to give tranexamic acid, and you're also going to give blood, so that at least the woman does not die due to anemia. So, ladies and gentlemen, with that done, we move to the next set of headings, and that is the subsequent care. So, in the subsequent care, we're going to have our environment, our positioning, observation, and the rest of the headings. But before that, what we have discussed so far is simply the immediate care, which you're supposed to include in your management. Without these parts, you are at risk of failing this question in an exam. So subsequent care is now where we have environment. So when you're writing points on the environment, you can maximize what's to explain by writing the following subheadings. Word. Which word are you going to care for this patient? Number one is labor word, where the PPH occurred from. Secondly, you're going to take this patient to gyne ward because complications of pregnancy are nest from a gynecological ward. Secondly, area of admission. I will nest the patient in acute bay for close monitoring and observation. Thirdly, bed accessories. You can say, I will mobilize a drip stand for fluid administration, oxygen cylinder or saturator for oxygen administration, a bedpan so that the patient does not have to go to the toilet, and other things that are important, a TPR tray and the like. Then fourthly, you talk about ventilation and lighting. Here, I have open nearby windows to promote ventilation, adequate lighting so that you can observe the patient easily. And lastly, cleanliness. The patient will be nursed in a clean ward with a floor that is well mopped, surfaces that are well dusted. With that being said, we go to the next heading, and that's of positioning. So for a patient with PPH, you nest them in semi-Fowler's position. Secondly, you elevate the limbs so that you promote venous return by force of gravity. Because when the limbs are not elevated, knowing that the blood pressure is low, this might cause pooling of blood in the lower limbs and the patient might have swollen limbs. Also, 2-hourly turning, which is very important. And lastly, you can nest the patient in their position of preferred comfort subsequently. With that said, ladies and gentlemen, we move to our last set of headings. So here, the most specific and important heading is that of observation. You observe the Glasgow Coma score so that you know whether or not the patient will remain in the gyne ward or the patient needs to go to ICU. Secondly, you check the temperature of the patient. Why? Because the patient's temperature is at risk of reducing due to the reduced blood volume, because blood is responsible for distribution of heat. So when there's less blood, it means the patient's heat distribution is also impaired. Last, followed by that is pulse. Pulse so that you observe if there are any cardiovascular dysfunctions such as tachycardia or bradycardia, or even arrhythmias. Respirations, obviously the woman might be grunting. Secondly, the woman might be tachypneic because the woman is having less oxygen perfusion in her tissue, so she's going to either breathe deeply or she's going to have scanty breaths. After that, we check the blood pressure. Why? Blood pressure is at risk of being low, hypotension, because of reduced blood volume. Or the blood pressure might be high. Why? Because we give ergometrin, which has a tendency for increasing blood pressure by reducing the blood holding capacity. Lastly, you observe for perineal bleeding. These are the most specific points under observation. Then the rest you can now write the other things that you would like to write, such as eating habits, sleeping habits, how the patient is coping with pain, etc. Then the last set of headings are these. You can include general explanations under psychological care, nutrition, exercises, hygiene, infection prevention, as well as IEC. With those explained, ladies and gentlemen, we've given a brief but rather detailed explanation on how to go about with the management of postpartum hemorrhage. If you like the video, please don't forget to leave a like and share. If you have any questions, drop them in the comment section. I'll attend to them as soon as possible. Until then, thanks for watching this video.